My name is Debbie Reynolds. They call me the Data Diva. Today I want to talk about data privacy, the United States Federal Trade Commission health breach notification rule. All right, this is going to be really interesting. So the FTC has a rule called the health breach notification rule that's been on the books since 2009. And the recent commissioner of the FTC had put people on notice that they will start enforcing this rule. Up to this point, this rule had not been very heavily enforced, and actually there's only been, I think to date, only like 4 companies that did self-reporting. So the purpose of the health breach notification rule is to address entities that are not or don't have to comply with HIPAA. So companies that have to comply with HIPAA, whether they be what is called covered entities or business associates, they have rules about how they have to handle data that they receive as a result of a transaction between a patient and provider. Because there are so many apps and so many types of ways that companies now that aren't health providers get health information, this is really the reason why this health breach notification rule was created. So if you think about things like Fitbit or maybe an app on your phone that you download that you could track your, let's say, your heart rate or something about your health, those particular things, because you aren't a patient and they are not a provider of medical services, they are not covered by HIPAA. But that created sort of this loophole where there were other companies that could collect this information without sort of getting in trouble or having particular regulations they will be concerned about in terms of how they handle that data. So basically, this health breach notification rule has a definition for a personal health record, and any entity that sort of collects this information could be considered as having a personal health record. So it could be something as simple as, let's say you have an app and it knows sort of your name, your phone number, and that you have a particular health condition of some sort. That could be considered a personal health record. This particular rule they have is called breach of security. So their breach of security rule is broader than what the 50 states define as a data breach, right? So all 50 states in the U.S. have a data breach notification rule, and they define what is a breach, what's personal data. This breach security rule is much broader because part of what they consider breach security is the transfer of data to a third party without the authorization of an individual. So let's say you have a health app that you download, you put in information about your health, and that particular app decides that they want to sell your data to another company. That would be a third party data transfer, and if they never notify you about it or gave you, well, they would have to get your authorization basically. If they never got your authorization to do that transfer, that sale, then they will be subject to this particular rule. Also, a couple of more interesting things about this rule are that it has a stipulation that if someone's health record or personal health record was breached in a way that they say that if it was more than 500 people, that the entity would have to give notice to the media, and the FTC could seek civil penalties against a organization for, I think it's over $40,000 per violation per day. So this is really one to look out for. We're seeing, as a result of COVID, so many apps coming out that are trying to gather information about someone's health, and sort of other tangential apps that are collecting data also about someone's health that aren't health providers and don't have the same level of sort of responsibility and liability that they would have if they were sort of a patient provider situation under HIPAA. So it remains to be seen if there will be more enforcement of this. We've not seen it yet, but we shall see, because this is a pretty tough rule for companies that were not accustomed up to this point to be regulated in the same way. That's it. Thank you.